All right, welcome back into Twin Cities Live. It is a Thrive with Twin Cities Live. January is Cervical Cancer Month. Almost all cervical cancer is caused by the HPV infection, so prevention is really important.
Joining us today with more to help us thrive with Twin Cities Live, we have Dr. Angela Ziebarth. Did I pronounce that right?
Ziebarth.
Ziebarth.
Close.
We got there. Doctor, welcome to the show. We're so happy to have you here. I feel like people think they might know what they should know about cervical cancer, but there are so many things that we don't know, and it is preventable somewhat, correct?
Yes. So I think this is a really good January Cancer Awareness Month because there are very few cancers we can actually prevent. And this is a big one. So the number one risk factor for getting cervical cancer is HPV virus. Now, you think that this might be very uncommon, but it's for men who are sexually active, 90% have had this virus at one point, 80% of women. So it's extremely common virus. The nice thing is that with this HPV vaccination, we teach your body how to fight it off. Because if you don't chronically have this infection, then you don't develop these HPV-related cancers. So that includes like nose and throat, and then cervical, vaginal, vulvar cancers, and some men's cancers as well.
Yeah.
And so it's exciting as a cancer doctor to actually be on the front end of something instead of just reacting to disease.
Right.
Yeah, absolutely.
Right.
Let me ask you a dude question, because, you know, I don't have one of these.
Yes.
What exactly is cervical cancer?
Yeah,
I mean,
You don't have a cervix, is what you mean? One of these,
I
you
mean,
need a
no,
cervix.
newsflash, breaking news.
I was like, what don't you have?
I don't have the
cervix.
parts, but so I am just curious. Like I've heard of ovarian cancer. I know that men and women have specific cancers for their specific issues.
Right.
So exactly what is cervical cancer? If we can start with the 101.
Right. So the cervix is the exit portion of the uterus. So the lower part of the uterus is where the cervix is. It's the part that has to dilate for a baby to come out. And so that area has a transition of cells that are more similar to the inside of your body to the cells that are more similar to the outside of your body. And that transition area is really susceptible to this infection, which is why if we can get your body to fight it off, then you don't get it.
Okay. All right. So you talked a little bit about the HPV vaccine. I know we're going to chat with that, but I do want to talk about the risk factors, or even really the symptoms. Like how do you know you might need to see a doctor?
Right. So when we think about kind of the prevention and the symptom burden, if you haven't gotten the HPV vaccine and you've had HPV for a long time, the first symptom of a true cancer you might have would be bleeding that's abnormal. So vaginal bleeding that's happening between periods or after menopause, or something, bleeding after intercourse. Those might all be symptoms that would be very concerning. But the most concerning thing is really not getting the appropriate screening. So if you get your Pap testing, the idea is that most patients would contract, they'd get HPV in their 20s. They might have dysplasias or precancers that are caused by this in their 30s and 40s, and then ultimately develop cancer in their 50s. So we've got this long, like 20-year period.
So it's not like the same year you contract it, you could be, I mean, it can take a while.
It takes a long time, which is kind of part of the beauty of it, because we can actually catch it before it's full-blown cancer the majority of the time with Pap testing.
Right. And then how treatable is it if you catch it on the front end?
So the dysplasia, so the precancer, super treatable.
Yeah.
Very, very treatable. Early cancer, pretty treatable. The more advanced it gets, the more difficult it is to treat. And so we're looking at using radiation and chemotherapy. There are new like antibody-directed conjugates and immunotherapies that we can use for advanced cancers, but none of them are as good as just preventing it in the first place.
And that's the HPV vaccine.
Yes.
That I know that they're offering. I know my girls in the pediatrician's office, they've talked to them about that.
Yes.
So it's happening at quite a young age.
Yes. So for the HPV vaccine, boys and girls are eligible between 9 and 25. I'm sorry, Yes, 9 and 45.
Oh,
9
wow.
and 45, you can get this vaccine.
Okay.
When it initially rolled out, it was between 9 and 25. And so there's this kind of gap generation, which I'm in, where when the HPV vaccine was rolled out, I was older than 25, right? But then they expanded it. So I, as a cancer doctor who should know better, got my first cervical cancer vaccine the day before I turned 45.
Okay.
And so I think it's important for people to know this is not too late if you're
Right.
up to 45. Then the next thing that's super important and very underpublicized, and even your doctor may not know, is if you've had dysplasia, you've ever had a procedure on your cervix, or you've ever had a bad pap, and they've said you have HPV, you are still eligible to get the HPV vaccine, and it still decreases your risk for cancer and dysplasia. And that's like huge news, because now we have this opportunity to catch up on the patients that may have missed it on the front end.
Yeah.
And thankfully, the ASCCP just put out a guideline that said, yes, for sure, this is recommended. And so if your insurance company doesn't feel quite as compelled as I do, that's okay. We got a guideline backing us up now.
Holy cow,
Very
that's
good.
a lot of great information. I mean, there's a lot of people out there that probably were just like you, thinking like,
I'm too old. Like, I'm
I've
past it.
aged
Right.
out past this,
Right.
so this is all great news. Yeah, thank you.
Doctor,
Good to
thank
see
you for
ya.
being here. We appreciate it.
Thank you.
Really
All right, so to learn more about cervical cancer treatments and providers, Minnesota Oncology is Twin Cities' largest and only independent care provider. They offer expert, compassionate care close to home.
And Minnesota Oncology has more than 100 cancer care specialists in multiple locations across the metro. And the Colon and Rectal Surgery Associates recently joined the practice, expanding comprehensive care options. So you can learn all you need to know at mnoncology.com.
All right, when we get back, we're going to check back in with Elizabeth at the auto show. You guys heard her right there. She's live in the Avenue Made of Dreams. We head over to Luxury Lane and share the brand new luxury vehicles pulling up to the Twin Cities market in a really, really expensive car, too, right after the break.